Awesome. So my name is Stacy, and I am responsible for most of the user support and training when it comes to InfoEd. So I'm going to do the demonstration today. Normally, I like to have my camera on so people can see that I'm a real person, and it's just a little easier to follow along, I think. But we sometimes have some bandwidth issues, so I'm going to leave the camera off for this one and make sure we don't get any interruptions with connectivity issues due to that. So apologies for audio only today for me as the presenter. We are here today to talk about creating proposal records in InfoEd for clinical trials. This is something that we've already been doing for a number of years with our externally funded grant submissions that people are applying for, and we are now getting caught up with the process in clinical trials. So creating proposal records is not a new thing for the research community, but for folks involved in clinical trials, it maybe is going to feel new because we're just now really getting our practice up to speed for all of you with how we're doing our InfoEd records, specifically for non-federal clinical trials. So again, this is going to be for things that are not NIH sponsored, not federally sponsored, mostly things from industry or sponsored by a company that is using a CRO, and we're part of the CRO's participant list. So let me just go through a couple of introductory details here, and then we'll get right into the demonstration. So the folks involved with the InfoEd tech support and any kind of training that may be needed after this are myself. Like I said, I do most of the training and support for users of InfoEd, and my colleague Rick Francis is the Director of Research Advancement. He does a lot with reporting and just generally guiding some of the things we have to do with data and whatnot for research. And also our Director of the Office of Research and Sponsored Programs, Michelle Shipman-Stoller, will be joining us when she can. She manages the staff that works with folks on all of their grant applications, as well as the clinical trials administrative staff over here in ORSP. And a couple of little things about how the seminar will run today. There is a live captioning feature in Teams. If you want to turn that on for yourself, that's managed on your side, not from the presenter side. If you do have questions, feel free to post them in the chat. Rick will be watching the chat feed and letting me know if there's something that needs to be addressed to the larger group. And if everybody can keep their microphones on mute, that will help, of course, with the echo. And I know you all are pretty experienced at this point with virtual meetings, so that's just a friendly reminder. We are specifically going to do a full demonstration today of creating a proposal record from logging into the system on up to all the things that you're going to put into the record, and next steps for where the process will go after the things that we're accomplishing today, like what are the next steps after you've got a proposal record created. We are happy to take questions, and we do have resources we can share with you. And also I will continue to be a resource for folks who want to do something like a one-on-one or a refresher, or if you have a quick question, I'm a resource for that as well. The first thing is that you'll start by logging into infoed.utoledo.edu, which some of you may not have ever been in the system before. And so if you have been in the system before, this might look a little familiar. If you have not, you may have trouble logging in. And if that is the case, then we would like for you to send us your first name, last name, bracket number, and UTAD username to infoed@utoledo.edu. If you are not yet in our system with a profile, then you won't be able to log in. And so if you go to log in and find that you can't get in, that's probably the problem. And it's very easy to fix if you just email us at infoed@utoledo.edu. But these details, we'll get that profile created for you really quick. So I'm going to switch over now to the demonstration in InfoEd, but I just want to pause here for a second and see if anybody has a question at this point. Sounds like there's no questions just yet. Okay.
So I do have a question.
Yes, go ahead.
So you say this presentation is strictly related to non-government funding. Is that correct?
I would describe it as creating an InfoEd record for a clinical trial sponsor that is not a federal sponsor.
So
So
if it is federal sponsor, it doesn't apply?
I'm really glad you asked that question, actually. If you are applying for an NIH clinical trial, you will use InfoEd, but there is a slightly different process for you in that there will be an opportunity that you can search for and select in the system, in the InfoEd system, and then you will get the NIH specific application package, which is going to look different from the package we're going to be working with today. And I would be happy to work with you if you're not sure how to do an NIH sponsored clinical trial. Today's demonstration is going to focus on all the ones that are basically not NIH.
Okay.
But there's a lot of overlap.
Other government fund, which are not NIH, but government, such as, like patient-centered outcome research institute, which is a government.
Yeah.
That's apply here too or not?
I'm going to defer to Rick on that.
Yeah, I can jump in. Yeah, it's the same system, and there's a lot of overlap with what Stacy's going to show you, and what you would do for one of those PCORI grants, for example. So yeah, this is not a waste of time, but it's just going to show the kind of the quirks peculiar to clinical trials that are privately funded, corporate funded, but lots of overlap, pretty much the same starting point and same endpoints, just a little different in the middle.
Good. Okay. Thank you.
Yep. And again, after today's demonstration, if you want to do a follow-up or a one-on-one with me to get yours specifically set up, that would be an option. So thank you, Rick, for that. This is what the InfoEd homepage looks like. I am logged in as our one of our test profiles, which we lovingly call 9 faculty. So they don't get a real name, they just get a test name. And so I'll use this profile to demonstrate what things are going to look like for you, because this is what the typical general user researcher sees when they're in InfoEd and when they're creating records. So this homepage has some important menus in it. This blue bar across the top has a couple of things you're going to want to know about in terms of finding records. Locate My Records is the tab you would use if you're looking for something where you are the PI. Locate Records, minus the word my, is going to be the tab that you use to find records where you are on the record, but you are not the PI. So you don't own the record, you're just on the record that someone else owns. And you're going to find that here with some filters that you can apply to get the right thing that you want to look at. And then we have a quick find feature over here in the upper right corner, where if you know the name of the record, the number of the record, or you know the name of the PI, or you know keywords in the title, you can use any of those to start typing in this quick find field, and it'll pull up based on the string of characters that you type in here. So those are some quick and easy ways to find records when you need to. On the left side here, you're going to see a white menu Proposals is the module we're going to work in today for creating the record. There's also conflict of interest and SPIN. SPIN is a search tool for funding opportunities. We're not going to talk about that in any detail today, just pointing out that it's here. And then this middle area with these white boxes, these are called widgets. And these 3 widgets, the financial conflict of interest disclosure, request for an entity for COI disclosure, and down here, system messages. These are on the homepage at all times. You can rearrange what order they're listed in, but you can't get rid of them. We don't need these widgets today, but I'm just pointing out that they are there. So let's get started with creating an actual proposal record. You're going to click on the proposal module in the left white menu, and then you're going to see this screen, and under proposals, create new, click this proposal button, and you're going to get our create screen. And this is where everything gets started for creating a record. The first thing I want to point out is that whoever clicks the create button is the name that's put in this first field, which is the PI's name. If you are the PI and you click the create button, your name will be here, and that would be appropriate and exactly how things need to be. If you're a clinical research coordinator or some kind of department staff member and you're creating a proposal on behalf of a PI, your name is going to show up here initially, but you can click into this field just by clicking on it and type over that name that's pre-populated and put the name of the PI that it is supposed to be. If you are not the PI, but you are creating the record, there are some additional things you may need to do to have access to the record later, and I can address that at a slightly different point in today's demonstration. But you'll need to be on the record either as a named person in the personnel list or as a delegate of the PI who is listed on the record. The next field is going to default to create a new proposal. You can leave it like that. We have a copy from existing proposal functionality that's not particularly useful for clinical trial records. It does get used for externally funded grant records, but I don't see where it's going to be much use for folks for clinical trials. So you can just stick with create a new proposal and you'll be fine. And then proposal type is going to default to new. There are a few other things in this list that do not apply to clinical trials. They're more so for other types of submissions like some NIH things. So just leave this on new for clinical trials. In the middle, we have these 4 questions that are going to help you figure out how to set up your record and how to search for the sponsor. You can come back and review those when you have a minute to read through those on your own. Today, I'm going to just basically explain what this is. I'm going to explain out loud what this is already walking you through in the written questions. Down here, you've got this drop down, select from grants.gov. This would be what you would use if you were searching for an NIH sponsored clinical trial opportunity, for example. You would leave it on grants.gov, but that's not what we're doing today. So we're going to use the drop down. We're going to skip over the SPIN opportunities. We're not using that today to search for anything. And we're going to go directly to set up proposal manually. This will give us the default template that we need for all of these industry-sponsored clinical trials. Once you've clicked into that drop down and selected set up proposal manually, then you're going to type in the name of the sponsor. If the sponsor is an entity we already have in InfoEd, once you start typing in the name, it'll pop up and you can select it. And I'm going to show you how to do that in a minute. But first, I want to tell you what to do if you have a sponsor who is not yet in InfoEd. They're a real sponsor, but we just don't have them in the InfoEd system. Then you're going to use our TBD sponsor, our to be determined sponsor. If you start typing the words to be and then determined, it'll pop up and you can click on it to select it. And that will be your placeholder sponsor for the moment. And then I'll show you all later where you can add the details of the name of that sponsor, and you can request that they be reviewed and vetted for use as a sponsor. So if you have a sponsor and they're not yet in InfoEd, you can use our to be determined sponsor and tell us on a different screen. I'll show you where. You can tell us the name of who that sponsor should be. But if you have a sponsor and they are in InfoEd, then you just start typing the name and we'll select them. So for today's purposes, I picked a CRO that we have on record. Just for demonstration purposes today, we're going to use the Colorado Prevention Center. They're functioning as a CRO today in our demonstration. So we type and search for them and select them. Now they're in that field, and then we can move on to the title field. We do ask that you use a convention of putting CDA and then, sorry, talk and type. CDA at the front of the title with a colon and then the PI last name. If you can put that in the title, that will help us to recognize more easily what type of record this is, and it'll help us find things a little faster when we're working through things on the administrative side. I'm just going to add a little descriptor here for my purposes, so I remember this record is a test record. Okay. This title can be edited later and become more clinically appropriate once you know what it needs to be. But for the sake of today's demonstration, CDA colon PI last name, going forward, that should be enough to get you started. The next thing you have to have on this screen is start and end dates. We know that those dates may not be completely clear or maybe not clear at all at this stage for some of you. These dates can be edited later. It's not a difficult thing to do. So for the sake of getting your record started, I would recommend just putting in one calendar year. You can start with the fiscal year for the ease of data entry. Just to give us a one calendar year to work with for the sake of creating this record. If you're later on in the year and you want to use a calendar year starting in January and give it one full calendar year, that's okay too. You'll notice that when you put the dates in the date fields, then this project periods field automatically calculates based on how many calendar years are included. We put in one calendar year, so this shows one project period. You can put in multiple years in the dates and then change this to show as one project period if you need multiple years to be counted as exactly one project period, which I believe is often the case with clinical trials. So once you have filled out everything on this screen, then you click the Create Proposal button. The system is going to think and gather all the parts that you need for your application package, and then we'll move on to the next screen when it's ready. Are there any questions at this stage just after doing the Create screen?
Hey, Stacy, I have a question. At what stage of the trial should we begin doing this? Is this something we should start doing as soon as we get that site selection letter, or should we wait for any agreement to be signed or anything like that?
My understanding is we want an InfoEd record as early as possible so that we can begin just tracking what's going on with that potential clinical trial opportunity. We know that possibly things won't go all the way through to execution, but we're still going to put in work to figure out if we can get to that stage. So an InfoEd record is going to help us have that right up front to work with. And yes, thank you, Michelle, for chiming in. I was about to call on you. Go ahead.
Yeah, start it as soon as you hear about it. As soon as you get a CDA, or even as soon as you hear something, it would be good to start it. This gives us a chance to, to see it and have a way to track it. And also this starts the process for vetting the entities that we would be working with, because we're trying to move that earlier in the process rather than later. So just so we're comfortable sharing information with the organization.
Got it. Thank you.
So
You're
a
welcome.
question for me. I got a question. So if I am planning to submit, a clinical trial to say, so I decide to, I want to submit, and I need to submit letter of intent, and that's the only information I have. Is that a time to fill this, or that I'll wait until I have complete, like engagement with the institution where I'm submitting?
No, that would be an appropriate time. As soon as you even start considering it or
Yeah,
are
so
exploring it, that would
in
be
the
the
planning
appropriate
phase.
time to start the record.
Yeah, in the planning phase. Okay, good.
Yes, and we
And
sorry, go ahead.
no, so while you are describing, I'm actually filling information for specific things. And when they put deadline here, date and deadline time, is the deadline for the letter of intention I put there. Is that correct?
Yes, yes. For the one that you submitted earlier this week, yes, that was
Yeah.
appropriate because yours is actually a little bit unusual situation because they do have a deadline for the letters of
Yeah.
intent. Most of the time, we're
Yeah.
not working
Mhm.
under a particular published deadline.
Okay.
Great questions. And just to reassure everybody, we understand, we know over here in the administrative office that there's going to be a lot of things that you don't know up front. So we totally get that. There may be questions you can't provide an answer to just yet in the record. You may only have an idea of what's going on, and that's okay. And anything that needs to be updated once this thing gets further along in the process, it can be updated. Title, dates, PI, personnel, all of that stuff can be updated if needed once we get further along and things are starting to clarify. So no worries. There's definitely a way to handle changes when they inevitably are going to come along. So once you've gotten past the create screen, you get to this setup questions screen, and you will need to complete this screen, answer all the questions on it in order for your record to appear on the report for Michelle to assign to a staff member to start tracking the record and working with you. If you don't complete this page, then you'll end up on a report for me, and I'll reach out and say, hey, I saw you have a record you started. It didn't get far enough along to be assigned a staff member. Do you need help? Is this something I can help you get it further along? One way or another, you'll end up on a report. It'll either get far enough that it gets assigned to a staff member, or it'll not get far enough, and then it ends up on a report for me to reach out and see if you had any questions or need any help. But you do want to start by completing this screen to move on to the rest of the application. There's some instructions up here at the top. Again, you can read through those when you get a chance. I'm going to summarize basically what you need to know for our purposes today. The first thing that will be important in the way that I've set up this record is that we've got the Colorado Prevention Center functioning as a CRO, and they are considered the sponsor for this record, but there is going to be an originating sponsor typically in a situation like that. So we want to add the originating sponsor, and we're going to do that by clicking this blue change word. It's going to open another screen, and we're going to search for the originating sponsor. Over here the second field down says originating sponsor on the left, and we're going to click the word change next to Colorado Prevention Center here on this second line, and we're going to search for the originating sponsor, which for today's purposes is going to be Bayer Health. It should come up. So Bayer Healthcare Pharmaceuticals is going to be our originating sponsor for today. We search for them, select them, and then they're added as the originating sponsor in this second field. Click Save. Okay, that's just a reminder screen. And now you have Colorado Prevention Center. Hold on one second. Yeah. And then also what you're going to do with this question, this next question where it says, is this a flow through project? You're going to click yes. Did I do this out of order? Maybe I did. I was supposed to answer the question about the flow through before I added the originating sponsor, but that's okay. We have the originating sponsor listed here as Bayer Healthcare Pharmaceuticals, so we'll just click save. We don't need anything else on that screen. And
So what's meant by flow through?
yeah, I didn't do the best job explaining that up front. My apologies. In a flow through situation, this is where another institution is considered the lead institution, and we are doing work for them. So in the situation where there's a CRO, they're not the original sponsor. There's money coming from another entity to the CRO, and then the money from the CRO is coming to us. So that is usually how I explain a flow through project, that is flowing through another entity to us. And so that would indicate a yes answer to that question. If Michelle or Rick has anything more to say about that or a different way to explain that, feel free.
That's fine. I would just offer another example, just that's really common where,
Yep.
University of Michigan, let's say, is putting in the NIH application, and prior to that application, they reach out and want some of the work done here on a subcontract. So then you as the PI at UT would put this in as a flow through. So the money we would get, or we'd be billing University of Michigan. University of Michigan is the lead application with the application to NIH. So just, they're all kind of like that when they're flow through, but that's an example that's just more common.
Yes. Very good. Thank you, Rick. Okay, so is this a federally sponsored project? For our purposes today, it is not, although we know that NIH and some other opportunities for clinical trials are federal. That's not what we're working with today, so we'll click a no to that question. There's an automatic defaulted no for sponsor-specific reference for this proposal and for unsolicited application. So you can leave those as defaulted no's. And as we already addressed a little bit ago, usually there's not a deadline, so we're going to click no for our purposes today. But if there is a deadline, you would click yes and you would put in the deadline information. If it's a yes, it'll walk you through how to do that. Are there, in the next section, general proposal properties, are there going to be human subjects? Probably, so I'm going to click yes. Will there be lab animals? I think that depends on the thing you're applying for, but for today, I'm going to put no, and no, it's not a training grant. And then this associated department, you don't have to do anything here. It's going to show the department of the PI that is listed on the record. So you can just leave that be. And then down here under budget setup information, select the program type. My understanding is that clinical trials are, generally speaking, health science, other sponsored activities. If it's on the main campus, then you can, select the main campus one. But I do believe most of them happen with the health science campus. So we'll click that for today. And then leave it leave the button for on campus selected. And we're going to click save and continue so that the system can process those answers and get the rest of our application package. And the first thing you'll notice is that you now have an expanded menu on the left, and we are now on the endorsement intake screen where we can provide some more information about the clinical trial. I will say, if you need to go back to the setup questions screen for some reason, you can. You just use the menu to navigate back to that. You'll notice that this check mark box up here next to completed is marked, and you can uncomplete that box if you need to edit this screen and make a change for some reason. And then when you're done, you can recomplete the box and it'll be marked as completed once again on the right side and in the left menu. So just pointing out that if you needed to come back to the setup questions screen and make a change, you can uncomplete in the upper right, recomplete when you're done, and then move on to the rest of your application again. So now we're on the intake endorsement screen. And again, there's instructions here at the top. I will mention that this e-form takes the place of our old intake form that we used to have on our web pages for ORSP, and it takes the place of the old RSP that used to be circulated for endorsement. So this intake endorsement e-form replaces both of those old forms that we used to use. So just pointing that out. Down here under demographics, you're going to see the proposal title field. This is where you can click into this box to edit the title if needed, or once you have clarified what the title needs to be for real, you can come here and make that change. It's pretty straightforward on how to do that. Your sponsor is listed. There's no deadline. Department comes over from the setup questions screen. And now here we are in the ORSP/UT resource engagement section. This first field says link to the solicitation or upload the solicitation if you have a document. We know that clinical trials may not have a solicitation per se, but they do have a CDA a lot of times. So if you are at the CDA stage and you're getting your record started as soon as you get that document, we would like you to upload that here in the solicitation area so that it's an easy access for people looking at this record, and there's a consistent place for people to find it when they're in the InfoEd record. There is another place where you can upload attachments, but we're asking that if you can put the CDA here, that would be really helpful for folks who are working on the record administratively. So I'm going to click the upload button, and then I'm going to search my files and find the one I want to upload. I have a demo CDA that we can use for today. Select it, upload it, click the upload button. And now this will be attached, as you can see right here, to this record on the intake screen. You do need to go back up to this field where it says link to solicitation and click and just type in NA. We're not pasting a link. We are just uploading a document here. Then you have to answer the rest of the questions on this screen. So we'll go through them quickly. You can always come back to me with questions later after today's training if you need a refresher on what's going on with these questions. And I'll help you through it in the future if you miss something today. So do the guidelines require a 501c3? That means you would be required to work. There is help text here that can explain this question. But basically that means that you are applying for something and they require you to work with a nonprofit. And for our purposes, the nonprofit would be the U Toledo Foundation. My understanding is that is not generally a thing with clinical trials. So you're probably going to put no for that. It does open up an additional question about congressional appropriation. That is usually also a no. And then the next few questions here usually don't apply to clinical trials. This next one, Office of Research and Sponsored Programs offers development help. That's for folks who are writing a lot of documentation, support documentation for grant applications. If you want help with the writing, we have a team of people do that, but that's not usually a clinical trial component. So we're going to click no for that. Usually not renovating spaces for these, and not getting new or reallocated space. And it may or may not involve export control. So you can click yes if you know that it does, no if you're sure that it doesn't, or click don't know if you don't know if export control is relevant to your clinical trial. This next section, institutional and proposal attributes, has a major goals section. This field is optional. You can put in a descriptor here if you would like. The form does not require that you put information here. I will defer to Michelle if she believes that that major goals section would be helpful for anyone.
It's at the very early stages, they may not have that information
Okay.
yet.
Yeah, that I figured. So this field is not required. You may not have anything to put there anyway. If you do have something you want to say about the major goals, you can put them there if you want to. The next question, class, new, that just is coming in from your set of questions. You can leave that the way it is. And the question below that, if applicable, enter the currently active or previously submitted RSP proposal number or banner index. That's not going to apply here, so you can leave this field blank. It's not a required field, so you can just skip it. You do need to answer the activity type question. It has the asterisk, so it's required. My apologies. It's spring and allergies are happening. Activity type is a drop down, and for our purposes, I forget which one this is supposed to be, Rick and Michelle. It's still research, right, for clinical trials?
Yes, it's still research.
Yeah.
All right.
And that's only by doing that do you get the clinical trial option to show
Yeah,
up
I had a little brain glitch. So I was like, no, it's
That's
research. So thanks for confirming that. So you're going to select research. There's a new question going to pop up below it. Is it a clinical trial? And you're going to put yes. You're going to cut a couple more questions, including phase, which we've got phase 1, 2, 3, 4, or not applicable. You may not be sure yet what the phase is. So you could put NA if you're not sure, or if you know for sure what phase you're going to be working in, you can select the appropriate one for that. And then you'll have to pick a role for you, Toledo, which most of the time we're not probably going to be the organizer. If we are, pick organizer, but most of the time I think we're not the organizer, we're the participants. So go ahead and click that. And then remember to come back to this field above UT role in clinical trial and select applied for research type, which I think is the most appropriate usually for clinical trials. The next question has to do with some data that we gather for the National Science Foundation. It's a big list. You can select the category from this list that is most appropriate to the project you're going to be doing as best as you can tell. This is a required field, so eventually it needs an answer. Even if you don't answer it the same day you're starting the record, that's okay. But eventually we'll need an answer for this, and you just pick the one that fits the best according to your knowledge of what's happening. Sorry, I heard someone speaking. Go ahead.
It's health science. Go ahead.
Yeah, that's the one I'm going to pick today. It seems the most appropriate, but if you saw something else in the list that you thought was more appropriate, you have control over what you select there. This doesn't drive anything about what we do with your record. This is just data that we gather for survey for the National Science Foundation. It's something we report on. Usually my understanding is that clinical trials are not going to have graduate students as personnel, so you're probably not going to need a College of Graduate Studies tuition waiver. You can select no. Also, I don't know if clinical trials PIs typically also have teaching requirements that would involve a course release. I think probably most of the time that's a no, but maybe not all the time. So pick the answer that's appropriate there. Also, I don't think there's usually cost share in a clinical trial, and the grant match through RSP is not going to apply for a clinical trial. Will this project involve outgoing subcontractors? If it does, and you click yes, you would fill in this box of who you're going to be outreaching to and potentially using as a subcontractor. And if it's no, you select no and that box goes away. I will defer to Rick and or Michelle if they want to say anything more about the subcontractor concept with clinical trials.
It's probably not going to be used.
Okay. Sounds good to me.
Yeah. So question, if the clinical trial involve multiple sites, outside UT, such as in my case, I'm involved in UFM as well as Wayne State. So is that where do I add those? These are
If
subcontractor or what they are?
Yeah, if I could answer that one. If so, up above you had the selection of UT role and clinical trial on the right, and
Yeah.
currently the selected participant. And what you're describing, if I understand you right, is when UT would be the organizer, where
Mhm.
Yeah.
we would be contracting with other sites. So yeah, that is another possibility. You could be picking organizer, and you could be picking yes, will involve outgoing subcontractors. Absolutely.
Okay, thank you.
Yep. Great clarification there, Rick. Thank you. And again, we're doing this demonstration from a somewhat generalized perspective, knowing that not everybody is going to have this exact situation. And so thank you for asking your questions. And again, feel free to reach out to us after the fact if you've got a situation and you're not sure how it applies based on what you've heard today. I see we have a question, so go ahead, the person with their hand raised.
Yes. Hi, this is Mehrush from Transplant Research. I have a quick question regarding the UT role in clinical trials. Since we have a research project, which is going to be the investigator-initiated research, which is funded by the sponsor, just wondering if it does apply in this InfoEd, and also the UT role should be organizer.
You said it is going to be sponsored. It is going to be sponsored.
Yes, but we are doing that clinical trials just at UTMC.
Okay.
I usually say if the design and the protocol is from the sponsor, then we would not be the organizer. I mean,
No,
that's
we would be a participant. Yeah, I was trying to think, like, yes, we would still be a participant.
Actually, no, we are developing all those kind of clinical
Okay.
documentation, like the protocol, everything.
Yeah.
No, just the fund is from the sponsor, nothing else.
Okay.
We are
That is it.
designing the study.
Yes. Then yes, I would say that is investigator initiated, and so yeah. But I just wanted to. That was the kind of the test for me, is to ask that question, and so yeah. If
Sure.
the answer is UT's the UT's PI has designed it, and then sure, then you would fit the other
Okay.
category.
And it's still, for this kind of a study, still we need to complete the InfoEd
Yes.
information.
Oh,
Right.
yes.
Okay.
Yes.
Okay. And also I have another question, quick question. Also, because I'm working on the sponsor clinical trial, we are almost at the end of the process, study startup process. Still, I need to complete this application, right? For that sponsors,
You're working on which one?
the Sanofi one for Dr. Reese.
Oh, I believe that record already exists. I think
Okay.
that one already exists.
Okay, sure.
We have not been making anyone go back and do them
Right.
for things that were already in process. We kind of
Right.
stuck with our previous method of doing this, but I
Okay.
think that one already exists. I think maybe Nikita already put that one in there. I'm
Okay,
gonna
good.
look, but I think so. No, you shouldn't have to go back and do that.
Okay, but for the other one, I should start working on this one too. Thank you.
So the rule of thumb, I think, is that when there is externally provided funding, it's considered sponsored, and we're probably going to need an InfoEd record for it. In terms of the clinical trial InfoEd records, these trainings are like from this point forward. So if something has already been established and executed prior to this, like Michelle said, it is what it is with our previous system, and the InfoEd record creation will be this point forward practice.
Okay, good. But it has not been executed yet, but yeah, I got your point.
But I
Thank you.
think there, like Michelle said, there may already be, you would not have created the InfoEd record. Nikita may have already done that.
Sure.
So Yeah.
Yeah.
She
Okay,
has.
makes sense.
It's in there.
Yeah.
I just double checked. It's in there.
Perfect.
Okay, perfect. Thank you.
So, so when in doubt, if you've already been working on something, you're not sure if it already has an InfoEd record created because of Nikita doing that, you can reach out and we can get you confirmation on that. For anything that is just now being considered or coming up, we're going to say just jump straight to putting it into InfoEd to get it started.
Okay. Yep.
Yeah, great questions.
Thank you.
So I think we covered the kind of the rule of thumb for when to select organizer and when to select participant. If UT is the organizer and we do have outgoing subs of, you know, other sites that are going to work with us, then your outgoing subcontractor question may need to say yes. And then you would list in this box that comes up what those sites are potentially going to be. And if we're the participant and then subcontractor wouldn't apply, click no, that box goes away. What I do want to point out is this box here that's labeled additional comments. If you are using a TBD sponsor because your sponsor is not yet an InfoEd, this is where you're going to put the name of the sponsor that you need to have requested, and you're going to explicitly ask that that sponsor be that a sponsor request be submitted for that. So I'm just going to type that here as a reminder for us today. Put name of sponsor here and request that they be and ask that a new sponsor request be submitted. There we go. So that's where you would put those details if you did use the TBD sponsor. This additional comments box is the place where you can put the details for that sponsor to be requested. Okay. The compliance information section is more of just reminders, and this personnel section is more of just a display of the content on your personnel screen, which we have not looked at yet. We'll do that in a minute. This personnel section is not where you're going to input any information. It's just for looking at, and it's not particularly useful, so you can basically ignore it on this screen. Shared credit involves data that goes into our Faculty 180 report, and you can read about that policy and practice here under detailed explanation here. And to add the PI to this record, you're going to click the add button on the right, search by name for the person who is the PI. We're using our Faculty 9 person today, so search for them, select them, and put in 100% credit for them because they're probably the only named faculty member on the trial, on the clinical trial record. And then also this budget summary is a display of our budget tool in the record. It's not where you put any information in for a budget. And also we know that. I'm sorry, what's that? Yep, go ahead.
A question I have. So when you say here a credit, you mean like academic credit to the person, so it will appear as assessment. So we can add names who we think contributed to the thinking about the application. That's or
Yes. Yeah, that's actually
okay.
a pretty good way
And
to
when
put
we
it.
say give them a credit, let's say we'll have to add the name of the PI as well, but already like, so under here we have to put all the names, those who share the credit, including the PI,
Yes.
or the PI. So you have to, okay. So and then the person's credit has to total 100. Is that what
Yes.
we say?
Yeah, and the link that Stacy mentioned there, where it says detailed explanation here, the blue one there, that takes you to this PDF that tries to clarify what it means and how it's used.
I see.
Generally speaking, my understanding is that the people who would be named in this section would be U-Toledo faculty who are in the senior/key section of your personnel list. generally speaking, that is how that section is used. If there would be people, where did my record go? If there would be people who belong in that section and for some reason they're not on your personnel list, I don't know if that is typical or not.
That would not be typical.
Yeah. So generally speaking, the people named in this shared credit section would be U Toledo faculty, and they would be named in the key/personnel section of your personnel list. And then you would agree amongst yourselves what is an appropriate distribution of credit. And this is an acknowledgement, not, there's no money tied to these percentages. It's just an acknowledgement of who contributed, like you said, to the thinking and the work of the project. Okay, so the budget summary section, much like the personnel section, is not terribly useful on this screen. You can basically disregard it. The budget actually exists as its own tool elsewhere in the record, and budgets do not become a thing in a clinical trial record for quite a while. So it's unlikely that you're going to have any budget information to put in upfront to start with. So you can basically skip this area of the intake endorsement form. And then down here with the F&A distribution, also known as indirects or indirect cost recovery, you are going to put in the department of the PI. So let me find that person for faculty 9. No, that's not what I want. Sorry, faculty 9 is in one of our test departments. Test MC department. I realize we're doing a record for Health Science campus and my test person is a main campus person. So just disregard that discrepancy. For today's purposes, it doesn't impact anything. So click the department, select the department we want. And then if the PI is the only faculty member, then it's only their department that would get F&A. So you would input that department and then select 100 from the drop-down list and your F&A is done. If you do have multiple faculty and different departments are involved, you have up to 4 departments available that you can add, and then you have to use the drop-down list on the right to create a breakdown that equals 100. So we've gotten to the end of the intake endorsement screen. To be completely honest, the create screen, the setup questions screen, and this intake endorsement screen are going to be the bulk of the work that you do in creating a clinical trial record. And you're going to get through it much more quickly than what we're doing today in the demonstration. We're going kind of slow today to make sure everybody can follow along, keep up, and ask questions. But actually doing the create, setup, and intake screens in real life is really not going to take you nearly as much time as what we did today. We do have a few more things to show you quickly. I know that people have busy days, so we're going to try to wrap things up in the next few minutes, but we are available until 11:30 if people need it. Once we've gotten all the way through this intake endorsement form, you can click the validate button to see if you missed any questions. We did not. And so then you can click the complete square in the upper right to mark this complete. Again, like with the setup questions screen, if you want to edit this page after you complete it, you just uncomplete, makes it editable again, make your changes, and then come back up here and recomplete, and you're good to go. I'm going to open the budget tool so you can see what it looks like. We are not going to put any information in the budget today. The budget tool opens in its own screen. It looks like this. You can come in here and explore it if you want to just poke around and see what things look like. If you do end up having to change project start dates and end dates or the number of periods for the project years, then you can go to this setup tab, and that's where that will happen. We're not going to do that today, but just pointing out this is what the budget tool looks like, and the setup tab is where you do make changes to dates and the number of budget periods. So I'm going to just click done and get rid of that screen, because I also want to point out to you your personnel screen. This will be the place where you may be adding additional personnel. For example, you may, if you're the PI and you're creating the record, you may need to add a clinical research coordinator. If you are the clinical research coordinator and you are working on the record, this is where you can add yourself as personnel so that you can come back in and have access to the record again. Or, like I mentioned, the PI can set someone up as a delegate, and then that delegate would have access to come back in and work on a record if needed. So let me put in a clinical research person. We're going to use our co-investigator test person for today's purposes. So you select them by name. If the person you need to add does not come up in this box when you type their name, that means they are not in InfoEd, and you'll have to reach out to us at the InfoEd inbox and request that a profile be made for them. We're happy to do that. Then you select role, which for the clinical research coordinators, sorry about that. For clinical research coordinators, you're going to click other, and then you're going to use our drop down to select clinical research coordinator. Then you click save, and this will add that person as a clinical research coordinator to the personnel list. And this is how you can have a staff member create the record, change the PI on the create screen to the right person, and then add the clinical research coordinator here to make sure that the coordinator can continue to get into the record. I'm going to pause here for a second just because I want to make sure that this part of the process is clear for folks, and also see if there are any more questions at this stage. We're just about done. We've only got a few minutes left and a few details to show you, but are there any questions right here?
I have a question. The study we're working on, we have to get an ophthalmologist involved, and we don't have one in UTMC. So we have to work with someone outside of the system. Would I put that as a subcontractor, or should I put it here as a personnel?
I will defer to Michelle on that one.
At this point, at a very early stage like this, I would just put a note in the initial pages, the initial screens, that you're going to need to find someone to do that, and we can always go back and add it later, because you won't know at this point who it is. So yeah, I would just put it in here in the additional comments.
Yep.
At this point.
Thank you.
You're welcome.
Yes, this additional comments box on the intake endorsement screen is a place where you can call attention to a variety of details if needed. Not just requesting a sponsor be added, but also if you've got a personnel situation like what you're describing, you can put that here. And your staff member who is assigned to this record will have easy access to those comments as a reminder, and to know that there's some follow-up that's needed there. Great question. All right, so going back to the personnel screen, the only other thing I want to say about this is that if you add people to your personnel screen, the system will automatically add them to your budget. Or if you add someone on the budget screen, it will automatically add them to the personnel screen. Budget and personnel are intentionally linked in this system, so just making you aware of that. And then the last thing I want to show you is the attachments and routing screen. Michelle, go ahead.
So the budgets for these are not going to be built in InfoEd because there's a whole very long budget,
Yes.
not long, but complicated budget negotiation process for these.
Yes.
But what I want to point out on this page is you can see there are a few things. The COI on here next to people's names, that will let you know if if you need to do your financial conflict of interest, or if you
Yes.
click on your certifications and training and you don't see that research security training has shown up, you'll know that you will need to do that also, because we are trying to remind everyone, all researchers, that everybody has to do research security training. So that is someplace where you can see if you have done it, or if it's getting, or if you're getting close to expiring, something like that.
Great things to point out, Michelle. I'm glad you thought of that. So yes, when you click on certifications and training for anybody listed in personnel, it'll show you what we have on record for that. So you can confirm if something is needed. And then this COI column, the green check mark says that you did your COI and you have nothing to disclose. The red question mark, disclosure expired, or it's possible that an initial disclosure was never done. You may see that red check mark for that. If you see a yellow triangle with an exclamation point in it, that means that the COI was completed and there was something disclosed. You won't be able to know what was disclosed, but you'll see that the disclosure was done. So great details to know about on this screen. And like Michelle said, you're not going to put in any budget information at this stage, but if you add personnel on the personnel screen, they will be listed on the budget screen. So just don't be surprised if you see that. The attachments and routing screen is the last screen we're going to talk about today. You can basically disregard the finalized screen. We're not really doing a whole lot with that screen at this stage of things. You'll notice here that in this list of documents, the demo CDA that I uploaded on the intake endorsement screen is here, and you can look at it if you want to. If you have additional documents that you want or need to upload for this record, click on this link, Add Institution Forms Supporting Documents, and you can add additional documents here of whatever is needed. So I'm just going to pop one in here for the sake of demonstration. Let's use this one. So find it, select it, upload it, and it'll show up in the list. Click close. And now we've got that document, generic document in there that I just now uploaded. You can also remove documents here. If you added it here, you can remove it here. If you need to remove the demo CDA, for example, you'd have to go back to the intake endorsement screen to remove it and or re-add it if you uploaded the wrong thing or something. You cannot remove a document from the attachment screen that was uploaded on the intake endorsement screen. You have to go back to the intake endorsement screen to do that. And then the other thing I just want to point out, although you are not going to use this button for a while, is this is the button where you would submit the record to endorsement, or probably more likely the RSP staff person working on your record is going to submit it to endorsement. That is not going to be needed for quite a while. I don't think, because you've got to figure out who your people are going to be that are going to need to endorse. But this is where that happens. And as far as what goes in the record and what the screens look like, that is all the details we had planned to share with you today. Do have I have one more PowerPoint slide that I wanted to show you before we wrap up. But we've basically covered all of the content for today's demonstration. Rick or Michelle, did you have anything else to add before we close this record and wrap things up for today?
Just that if you are always still welcome to send a heads up to the RSP clinical trials team if you would like to. If you are a PI and you are working with a particular clinical coordinator, if you want to send a letter to the clinical trials mailbox and copy your coordinator so everyone here knows who you're working with, both of those things would be very helpful too. You don't have to send the follow-up email, but sometimes people feel a little more confident doing that, especially because I get a report to do assignments every morning. I don't necessarily find out that same day. And sometimes people will want a very they'll have a question or want a quick response to
Yes.
something. And I'm not going to see this until the next day and assign it to anybody. So if you have something that needs more immediate attention, just reach out to
Yep.
that box.
We aim to be as helpful as we can. All right. So once you've done everything in the record that you want to do or need to do for the time being, you can click this save button in the upper left corner just to make sure you've captured it all. And then you can click the done button to close out the record. That's going to return you to your screen that you were on before you created the record. And if you want to see where that record is now, I'm filled it out as the PI. So I'm going to go to locate my records, which is all the things I own as the PI. And you're going to see right here, P601957, CDA, PI, last name. This is the one that we just did right now today. Locate my records is the place where you find it when you're the PI. Or you can search by this number if you captured it before you closed it, or you can go to locate records and search with filters that way to click proposal. If you're personnel on the record, but not the PI, you can use this filter and type in your name. You can find the record that way. Okay, so that is that for InfoEd. I just want to flash before your eyes for a second. One last slide in my PowerPoint so that you are aware of how to contact different folks for questions and support. If you have an InfoEd related question, you can always start with our resource page. If you type in InfoEd on the UToledo search box on the UToledo website, just type in InfoEd and you'll get to our resource page from there. We have help guides, prior webinars. I believe we're going to try to post today's recording there for review if that's helpful to folks. And also at any moment, if you have questions about navigation or functionality, you can email me and Rick at info@utoledo.edu. We can answer questions. If you'd like to request a one-to-one tutorial, you can do that too. If I'm not available, Rick will help make arrangements for him to do it or some other arrangement if needed. And then as Michelle mentioned, you can always reach out to the clinical trials folks for assistance. What was that what was that email box again, Michelle, for your clinical trials folks?
I can put it in the chat here.
Sure.
It is, I always forget if there's a dot in the middle of it or not. Some of them do, some of them don't. I'm gonna copy and stick it in the chat for you.
All right. So thank you all for being here. We're so glad that you could log in and get at least some initial exposure to creating these records. As we've mentioned multiple times, we're here to help, and there's various ways to ask for that help. I'm still available for a little while longer if anybody wants or needs to stick around, but otherwise we're going to end the recording and let you all go on with the rest of your day.
Okay, well, since you are available, I just filled in the new proposal while you are talking and use, is there a way that you can review it and tell me if it's all well done?
Yeah, hold on one second. Rick, can you click the stop recording button on your side?